Hello, my name is Zanaya Webb, and this is my week 8 final return to demonstration video over a full head to toe assessment. For this video, I do not have a patient, so I'll just be using this stuffed animal here, and I'll just be going through the steps and performing certain parts of the procedure on the stuffed animal. To start off, I will start off with AIDed by introducing myself to the patient and letting them know that I will be their student nurse for today, and that I'll be doing a full head to toe assessment, and that it should take no more than 10 to 15 minutes. And I would thank the patient ahead of time for being cooperative and being a participant as I am completing my assessment. So I would start off with providing privacy by either shutting the door or pulling the curtain, and I will also perform hand hygiene. My patient will be in a gown so that I'm able to do certain assessments over bare skin. I will identify 2 patient identifiers by checking my patient's wristband. I will check for their name and their birthday. I can have them verbalize that to me, or I will have or I can check their name and their birthday on their wristband and match it up with the information that's in the computer to make sure that I have the correct patient. I will assess my patient's pain and allergies. So this is my patient, Mr. Bear. So I'll ask my patient to state if they have any allergies. My patient states that they have no known allergies, and I'll assess my patient's pain level. I'll ask my patient to rate their pain level on a scale of 0 to 10, 0 being no pain, 10 being the worst pain ever. My patient has stated that their pain level is a 0. So after that, I'll go ahead and check my patient's general appearance. So as I'm looking at my patient, I am looking at noting for my patient's level of consciousness. So I will check that my patient is A&O times 4 by assessing person, place, time, and situation with my patient. So I ask my patient their name. He states that his name is Mr. Bear. I will ask my patient what time it is. It is around 10 o'clock. I asked my patient, where is he right now? He states that he's in a bedroom, and the situation, my patient states that they're here for assessment. So this states that my patient is A&O times 4 because they're able to differentiate person, place, time, and thing. After that, I would check my patient's behavior, such as their mood and their speech and their facial expression. So my patient, his mood seems to be very calm. He seems to be very happy about the situation. His speech is clear when he has answered my questions, and his facial expression is appropriate for the situation. After that, I will move on to skin and nails. So I'm going to assess, first I'm going to start by inspecting my patient's skin. So I'm looking at my patient's skin, and I see that my patient's skin color is even toned throughout, and it's appropriate to my patient's race. There are no signs of lesions or wounds within my patient's skin. After that, I'll go ahead and inspect my patient's nails. So when I'm looking at my patient's nails, I'm looking for their nail bed. I'm looking to see that their nail bed is smooth. There are no signs of clubbing within their nails. And I can also check my patient's capillary refill by just pressing down on their nails, and their capillary refill should return back with less than 3 seconds, showing that they have good oxygen in their blood, arterial. So then after that, I'll go ahead on into palpating my patient's skin. So I will use the dorsal side of my hand, and I'll just kind of just run my hands down my patient's skin. So I've done that, and I'm noting that my patient's skin is warm and dry. After that, I will move on to my patient's head, face, and neck. So I'll go ahead and inspect and palpate my patient's head. So I'm looking at my patient's head, and I'm palpating, and as I'm inspecting and palpating, there are no signs of pain or tenderness as I'm palpating. My patient's head is normocephalic as I'm inspecting. I can also assess my patient's cranial nerves. So I'll go ahead and assess my patient's cranial nerves.